Hello, and welcome to our final segment on mental well-being with Dr. Charmain Jackman. My name is Lisa Gormley, and I'm a senior clinical wellness consultant at Tufts Health Plan. The My Members Wellness Employee Resource Group appreciates your commitment to being part of the conversation about mental well-being by listening to this podcast. Allow me to introduce Dr. Jackman, who is a Harvard-trained licensed psychologist with over 23 years in the mental health field. She currently serves as the Dean of Health and Wellness at Boston Arts Academy, the only Boston public high school for visual and performing artists. Dr. Jackman is the founder and CEO of InnoPsych, Inc., an organization on a mission to change the face of therapy and to promote wellness and healing for people of color. InnoPsych, Inc. was awarded the 2019 Citizens Bank Small Business Community Champion Award for increasing access to therapy through its online therapist of color directory. As a change maker, Dr. Jackman is passionate about the intersection of psychology, mental health, and diversity, equity, and inclusion, and has created social impact initiatives that support community members and mental health professionals. She's also the recipient of the 2020 American Psychological Association's PLC Diversity Award. Dr. Jackman loves talking about mental health and has been featured in both print and TV media outlets locally and nationally. So Dr. Jackman, I am so excited to host this final conversation with you today. So welcome back and thank you for being with us.
Thank you for having me, Lisa. I'm excited to be here. I can't believe it's 5 already. It's been so quick.
Yeah. And certainly over the course of, these last 4 sessions, you have shared so much insight with us, from the spectrum of emotional health and how stress can impact our emotions to some of the stigma around mental health care, particularly in certain communities. You've also discussed that mental health care isn't one size fits all, and how emotional health can impact our relationship with other people and our productivity at work. So managing how and when we express our emotions does require sustained effort and can be quite draining or even exhausting at times. So how do you recommend that we manage this and care for ourselves during challenging times, with this last year being a perfect example?
Oh, yes, it's right. It's been very challenging. And while things are getting better, I think there's still lots of things that people are going to be experiencing, whether it's returning to work, right? So, and, in some ways, I always tell people it is kind of life. Like, there are going to be great times, and then there are things that we're going to have to navigate and struggle through. So I think having resources that help you manage those situations is really important. So one of the things that I'd love to share with my members' wellness is my 3 M's for mental wellness. And the 3 M's are mindfulness, mindset, and the mind-body connection. And I'll go into the 3 of them really quickly. But I'll start with mindfulness. So mindfulness is a set of strategies that really are geared to helping people navigate stress and difficult emotions. And it's based on 3 main tenets that includes developing strategies that promote relaxation through breath work, being present focused. So the idea is that if we're focusing too much on the future or too much on the past, we can get really stressed. So that being present focused, when you're really dropped into a situation, is really hard to be present and also worrying about something. It just can't, your bodies just can't do it. And then the third aspect is that self-compassion, using a non-judgmental stance as we reflect on ourselves. Many of us have these really harsh inner critics that are almost punishing, right? That if we do something or we make a mistake or we have a thought that we don't like, there can be very judgmental thoughts that come with that. And so really the idea is like allowing whatever emotions or feelings that we have to notice them and then allowing them to pass without giving them any judgment, any more attention or energy than any other emotion or thought that we might have. And so those 3 tenets work together in these mindfulness practices. Some examples of mindfulness include um, guided imagery, again, like relaxation techniques. So breathing. There's so many different ways that you can breathe. I should get the number, but there's box breathing, there's slow breathing, there's starfish. There are many ways that you can breathe. And the idea is just to actually focus on your breath. And part of that trick, when you're focusing on your breath and your breathing, you're actually being present focused as well. So those are essential topics around mindfulness. The other M, oops, excuse me. The other M is, you might want to pause and edit that out. Our second M is our mindset. And I really talk about how do we start to develop a resilient mindset that, again, you know, in anything that we do, so long as we have breath, right, there are going to be challenging moments, challenging times. And so how do you navigate those and how do you approach and think about those challenging times is really important. We can approach a challenge with the idea like, this is hard, but I'm going to get through it. Or we can approach it with, this is hard and I don't know I'm going to fail. Like, and that kind of sets up a mindset for failure, right? So how do you develop a resilient mindset? Practicing affirmations. So propping yourself up, right? Finding words or quotes that really uplift and affirm you. Also practicing gratitude. So gratitude is this really simple thing, just noticing and being thankful for the things that you have. Can really change how you start your day. It can change how you end your day. There's a powerful technique that's shown to really improve satisfaction with life, happiness, reducing anxiety. So one of the things that I ask my clients to do is to start or end their day thinking of 2 or 3 things that they're grateful for. And if you do that, you'll notice that you automatically focus on things that are working or things that are going well. At nighttime, if you think about your things that you're grateful for, you're not focused on the things that you didn't get done or the mistakes that you made. It's a really small but powerful adjustment that you can make in how you start and end your day. Also therapy, right? I think therapy is a great process that helps people to reflect, notice patterns, and learn skills to help learn new patterns and new ways of coping and communicating with the people around them. And then the third M is that mind-body connection. And one of the things you've probably heard me say in the other episodes is that our minds and our bodies are intricately connected. And many of us kind of learn like to disregard our emotions, to disregard our feelings, to disregard what happens in our brain. But guess what? Our bodies and our brains are so connected that if we're having an emotional, stressful time, guess where it shows up first? In our bodies. And so being able to name and notice what's happening in your body is powerful information that you can use to navigate your life circumstances. So I really encourage movement activities. So I try not to use the word exercise because for many people, including myself, exercise comes with like rigor, working out, sweating, like, you know. And so it's really about movement. So how are you getting out and moving throughout your day, whether it's 10 minutes around the block or even 5 minutes if you have it, stretching if you have limited mobility, engaging in yoga, taking a walk, right? So just getting out and moving and being outdoors is really helpful. As someone who's worked around artists for the last 17 years, I also really noticed that in terms of that mind-body connection, engaging in some kind of artistic activity is also powerful because again, it allows you to get out of your head and you're engaged in something that's you're touching or feeling and working with, right? Whether it's drawing, writing, painting, those are great activities to help you, again, connect and release tension from your body. And it's not about, creating some work of art that's going to be some museum somewhere. It's really just about helping you express what's going on in your mind and in your body. So those are some strategies that I've found really helpful in working with my clients. So the 3 M's for mental wellness: mindset, mindfulness and the mind-body connection.
That's fantastic, Dr. Jackman. I feel like that was so much great information and so many great strategies that we could implement in our lives to try and work through challenge and care for ourselves. And I particularly like that you acknowledged that we might have this inner critic, or it's pretty natural sometimes to have this inner critic where we judge ourselves for feeling a certain way, and that can really make us feel worse.
For sure. And, the easy way, one of the things that I say to folks, the easy way to remember the 3 M's for mental wellness is really do what brings you joy. So many times we're running around, work and family, and we kind of forget ourselves in that equation. So really just remembering to do something that brings you joy, that makes you smile. If you just start with that, that's really helpful.
Great. Thank you. One of the things that you mentioned that can be used as a strategy for some people in managing emotional health is talk therapy. And some people, become discouraged when they are interested in talk therapy because they may struggle to find a provider who is actually accepting new patients, particularly with the increase in demand for mental health over the last year. And sometimes people become discouraged because they are working with a therapist, but they don't really feel that they connect particularly well, and so they assume, well, maybe therapy isn't right for me. So I wonder, what would be your advice to people in those situations who may be discouraged?
Yeah, that is such a wonderful question. I love it, Lisa. And it's kind of why I created the InnoPsych platform, because of that, those very things that you've named. And I'm so glad that you named talk therapy, right? Because I didn't really specify that. And I think it's really important to note that, talk therapy is one way of kind of being able to process emotion and patterns in your life, but it doesn't work for everyone. And I think it's really important to name that. And there are other body-based therapies that I recommend, whether it's yoga, there's also dance and movement therapies. There's art therapy where you can write or draw. So there's so many other types of modalities that if talk therapy is not your jam, that's okay. But being, I think, aware that there are other opportunities or other options is really important, because we often focus on the talk therapy. But if you're in a talk therapy situation, so at first you asked about having trouble finding a therapist. You're absolutely right. We are in a pandemic that required people to be quarantined and to really disrupt the way that they live, the way that they communicate and engage with their community. And it's really made people experience social isolation. So lots of people, for that reason, are looking for ways to kind of process this whole situation, sometimes being alone with your thoughts, maybe brought up things that you weren't aware of. I know for some people, relationships, being quarantined within your relationship kind of brought out things about that person that you might have overlooked for many years, but now you're like, life is too short, not doing this anymore, right? So there's so many things that have come out of this COVID pandemic that is really, people are actually craving and wanting therapy, particularly people in communities of color, which I think is really exciting. But yeah, so there is a dearth. The supply of therapists is low. And so one of the things that I encourage people to think about, so there are other modalities other than individual therapies. So you might want to consider group therapy. And I know that many therapists are opening that up as an option because it allows them to, connect, right? It brings community together. So that's an option that you can think about. I think there are many other, again, depending on where you're at and how severe your mental health concerns are, there may be other self-help things that you can do while you wait for the therapist. I would encourage you, try calling and getting on someone's waiting list so that at least you're in line or in queue. And meanwhile, there are lots of self-help journals. lots of resources that are geared to helping people process, start to process their emotions. There are also lots of apps that are coming out, and just be mindful to do a little bit of research on that are also helping people think about how to navigate and learn strategies to manage their emotional well-being. So those are some things that you can do while you wait for the therapist. The other thing you mentioned was fit, right? So one of the things I say is therapy is a little bit like dating. You want to make sure the person that you have is a good match. And I think many of us don't have that information. Like we think every therapist is the same, right? If you don't know, you don't know. And you don't realize that it's important to actually interview your therapist to see, one, do they work with the issues that you're dealing with? Have they worked with people from your cultural background? What's their style? There's some therapists who are very engaged and talkative. They may do homework. There may be some therapists who you come in and you're the one just doing all the talking and the therapist listening. So it's really important. Some focus are very solution focused. So it's important to think about, what do I want in this experience? What are my goals? What do I want to get out of that? And being able to have a conversation with that therapist beforehand to learn what their style is. Many insurance companies also will allow you to see a number of therapists for a few sessions while you kind of decide if this person will be a good fit. Just don't see two therapists on the same day. You might get a bill for that, right? So being able to talk with your insurance company and hearing what those options are. But I think it's important to, research your therapist and ask for a consult, and that will give you an opportunity to talk with them and get a little bit about their style. One of my clients, I always tell this story, because when she called, she interviewed me, and then she said something that was hilarious, and I started cracking up. She's like, "Oh, good, you have a sense of humor. That's really what I wanted to know, because I can't be in therapy with someone who does not have a sense of humor." Right? So she was clear what she wanted. So that worked. She has me laughing till today. So yeah. And I think, onto that point too, sometimes we be kind of, because therapy happens behind closed doors, and we see these very problematic images of therapists on TV, right? Most of them are not real. Some of the things that were portrayed. We kind of don't really know what happens in the therapy room, right? So it can be very mysterious. So again, doing that research, asking those questions. We're here for you. Our work is confidential, but therapy is a process where you're working through often challenging situations. But for me, anyway, it should not be so serious that you can't have a laugh during that time, right? So it's important to, again, find out what's important to you and be able to find a therapist that's a good match.
Thank you so much. That was really great advice. And, it sort of echoes a theme that you've sort of fed through each of these series, that there's a component of this, right, that's related to choice and what works for us. So different modalities may work better for me than for you or for someone else. Just like the approach of a therapist, if talk therapy is for someone, that may vary, and what works for that person may also vary as well.
Right, exactly. Yeah. And I love that you use the word choice. I've been using that a lot when I talk about my company, but people at the end of the day want choice. And I think we're in a situation where the demand and the supply is so off that people they just kind of get the first thing that they get. And, that's not what we want the system to be.
Yeah, absolutely. Absolutely. I wonder, as we sort of reflect on all the information that's been covered throughout this series, is there anything that you haven't had the opportunity to discuss that you want to speak to?
Oh man, there's so much, right? We could go for 20 more sessions. But, I think it's really important to, I think what I've said to people, this COVID time has really given me and many people an opportunity to kind of reflect on what is the lifestyle that I want for myself? And I really encourage people to think about that, and to really be able to honor like what is it that you want from life. I think one of the things we've learned, we've always said like life is really short, right? And what are the things that are important to you, and how can you make sure that you are including that in your life? My 3 words this year, I had my 3 intention, actually there were 4 words. My 4 intention words this year were faith, abundance, balance, and boundaries. And so that's what I wanted to invite into my life. And it's great because there are things, you know, balance was really important because I can tend to be a little bit off balance with work and my business ideas. But it's really helping me to honor those things. And it doesn't mean that every day is perfect, right? It's not, it's a work in progress. But if there's one day that I feel out of balance, I try to correct that for the next day. And I think again, like with anything, you know, the mindfulness, anything that you're doing and that you're building for lifestyle, it's practice and it's work. And there's a consistency that's there. And sometimes we tend to have this really, again, that inner critic, or that lack of compassion for ourselves. If we make a mistake, or if we don't do something the way we want it one day, we kind of give up on the whole process. And if one thing I can share is like, one day, get back on it the next day, right? Forgive yourself, give yourself some grace. Whatever happened or came up to disrupt that was something that was needed, or, you know, you can avoid. So just having that reflection and that mindset around that, and being able to start every day with a new slate and a recommitment to those goals that you have.
That recognition that it's not all or nothing.
Yeah, exactly.
Yeah, fantastic. Thank you. And I know at the end of each of these sessions, you always offer us a coping strategy that we can add to our toolkit. So I wonder, as we close out this series, what's one last coping strategy that you can share with us?
Yeah, I mean, the whole goal of this was to really think about our emotional well-being. And one thing I would say is remember yourself in the equation, right? In all the things that you're doing. And there's a wonderful quote by Audre Lorde who says, like, you know, focusing on yourself or self-care is not selfish, right? It's about self-preservation. And if you don't pour back into yourself, it's really hard to give anyone quality. Even if you think you might be giving back to someone else, the quality is going to be undermined. So how can you really create and prioritize taking care of your emotional well-being? Again, through that, you know, that's kind of a big picture piece. And one, you know, thinking maybe one every day, a moment every week, thinking about one thing that you can do for yourself that brings you joy. So whether it's your favorite coffee or dessert, or it's taking a walk out in nature, but something that makes you smile, doing something every day that brings a smile to your face. That's my strategy.
Great. That's such a great one. Really, that recognition that, you know, as Jonathan said, you've got to put your own oxygen mask on before you can, you know, take care of someone else and put theirs on. And I think that ties back to what you had mentioned before about one of your words for the year of boundaries.
Yes.
You know, particularly in this time where many of us are sort of in a place where work and life are in the same place, sort of overlapping all the time.
Yeah, for sure. Yeah.
Excellent. Well, thank you so much, Dr. Jackman. You know, it's really been such a pleasure speaking with you today. I want to thank you for, you know, for your time today, but also through each of these, you know, different conversations. You've shared so much insight and expertise with us, and we really appreciate it.
Thank you. It was an honor and a pleasure to be here. As I mentioned in my bio, I love talking about mental health and wellness. So it's been an honor to be able to connect with everyone in the My Members Wellness group. And I hope that everyone has found a tip that they can use or start to use to bring more balance and emotional well-being to their lives.
Thank you.
Thank you.